Hello friends, నా పేరు డాక్టర్ Abdul Azeez. I'm working as an interventional cardiologist at Mohammedpecialist Hospital, Manama. ఈ వరల్డ్ హార్ట్ డే సందర్భంగా నేను అందరికీ చెప్పుకోవాల్సింది ఏంటంటే హార్ట్ డిసీజ్ అనేవి చాలా చాలా కామన్ అయిపోయినాయి. ఎస్పెషల్లీ మన ఇండియన్స్లో ఎక్స్పాట్స్లో వి సీ లాట్ ఆఫ్ పేషెంట్స్ హ్యావింగ్ హార్ట్ అటాక్స్. దీంట్లో యాక్చువల్లీ కనుక చూస్తే చాలామందికి చిన్న వయసులో హార్ట్ అటాక్స్ వస్తున్నాయి. యాజ్ యంగ్ యాజ్ 30 years కానీ 40 years కానీ లాట్ ఆఫ్ పీపుల్ ఆర్ గెటింగ్ హార్ట్ అటాక్స్ అండ్ వీ హ్యావ్ ట్రీటెడ్ మెనీ ఆఫ్ దెమ్. చాలామంది అక్యూట్ హార్ట్ అటాక్ వచ్చినప్పుడు వాళ్ళకి యాంజియోగ్రఫీ చేయడం కానీ యాంజియోప్లాస్టిక్ స్టెంట్ చేయడం కానీ జరిగింది. సో వాట్ ఆర్ ద రిస్క్ ఫ్యాక్టర్స్ వై దీస్ పీపుల్ ఆర్ డెవలపింగ్ హార్ట్ డిసీజ్ అట్ సచ్ అ యంగ్ ఏజ్? అంటే లాట్ ఆఫ్ దెమ్ హ్యావ్ అన్నోన్ ఫ్యాక్టర్స్. అంటే డయాబెటీస్ ఉండొచ్చు తెలియకుండా, హై బ్లడ్ ప్రెషర్ ఉండొచ్చు తెలియకుండా, కొలెస్ట్రాల్ లెవెల్స్ ఎక్కువ ఉండొచ్చు. ఇవి కాకుండా కొన్ని అదర్ రిస్క్ ఫ్యాక్టర్స్ లైక్ ఫ్యామిలీలో హార్ట్ ప్రాబ్లమ్స్ ఉంటే, సపోజింగ్ ఫాదర్ ఆర్ బ్రదర్ ఆర్ సిస్టర్ వాళ్ళకి ఎవరికైనా హార్ట్ ప్రాబ్లమ్ ఉండుంటే అది మీకు వచ్చే అవకాశం ఎక్కువ ఉంటుంది. సో మీరు ఇంకా ఎక్స్ట్రా కేర్ఫుల్గా ఉండాలి అలాంటి సిచ్యువేషన్లో. అండ్ యూ షుడ్ గెట్ యువర్ సెల్ఫ్ టెస్టెడ్. ఎనీబడి హూస్ మోర్ దెన్ 30 years ఒక్కసారి ఇయర్లీ వన్స్ అన్న టెస్టింగ్ చేయించుకోవాలి. మీ బ్లడ్ షుగర్ కానీ, మీ బ్లడ్ ప్రెషర్, యువర్ కొలెస్ట్రాల్ లెవెల్స్ ఇవన్నీ టెస్ట్ చేయించుకోవాలి. అండ్ +1 ECG అవసరం పడితే ఒక ఈకో అండ్ ఎక్సర్సైజ్ ఈసీజీ స్ట్రెస్ టెస్టింగ్. మీకు వాక్ అండ్ ట్రెడ్మిల్ నడిపిస్తాము, దాంట్లో హార్ట్ ఎక్సర్సైజ్కి ఎలా రెస్పాండ్ అవుతుందో తెలుస్తుంది. సో దాంట్లో వీ విల్ నో ఇఫ్ ఎనీ బ్లాక్స్ ఇన్ ద హార్ట్. ఈవెన్ బిఫోర్ హార్ట్ అటాక్ రాకముందే బ్లాక్స్ ఉన్నాయని తెలిసిపోతుంది. అండ్ సో ఇంకొన్ని జాగ్రత్తలు తీసుకోవచ్చు మనం. So this is what I wanted to say, and please take care of yourself. Please stay healthy. Make sure మంచి డైట్ తీసుకోవాలి, డైలీ ఎక్సర్సైజ్ చేసుకోవాలి, వెయిట్ తగ్గించాలి, అండ్ టెస్టింగ్ ఇయర్లీ వన్స్ టెస్టింగ్ చేయించుకోవాలి. ఓకే అండి, థ్యాంక్ యూ.
Now I would like to welcome Dr. Azeez, Asad, Interventional Cardiologist Director, Cath Lab BSH Apollo Heart Center, Bahrain. Welcome to the stage. Thank you.
Assalamu alaikum. Good morning, ladies and gentlemen. Dr. Asad, Dr. Azeez, that's from here. My friends from the hospital and from all of the today is a very important day for us, and I would like to recall a few events that happened before I was brought to this hospital. And I came to Bahrain first in May 2019, and this was a meeting with the management. And I met with Asad, with Azari, Dr. Jafar was there that time. Yes. And we had a meeting that day, and we spoke about establishing a cath. But there were a lot of people who said, "Oh, don't go there. Bahrain is one country. They have a lot of difficulties. Setting up a cath lab is very difficult. They don't make a lot of things at a cath lab at all." But somebody also told me, Dr. Raja, Dr. Asad have decided and they are determined to pull off this cath lab, they will do it. I was very convinced, and then we started this process. And I came back in October 2019, and December we launched cath lab. Since then we've done 500+ procedures, out of which about 400 have been coronary procedures, about 100 odd have been peripheral and vascular procedures. And a lot of these patients were actually very sick, patients currently with a massive heart attack. There were patients who were brought in with very slow heart rates as low as 40, with very low blood pressures, like very 60 or 70. On the verge of collapse, a couple of patients had arrested already before they came here. They were very sick patients. We took up these patients to the cath lab immediately, and then the patients had fared very well, the outcomes were very well. And this has all been possible with the team effort, with the support from the management, of course, Dr. Asad, Dr. Azari, the brother that is supporting throughout, the medical team, the people from the emergency room, the nurses, the technicians, and I'm actually very proud to say that our what we call as the door to balloon time is very, very effective. Door to balloon time is the time from which the patient comes to the door of the hospital and is taken to the cath lab and the blood flow is re-established. So the world over the standard should be about 90 minutes, and we maintain it around 45 minutes or so. I don't know how fast it is. And so this is because all of us are very, very committed, very, very dedicated, And within minutes, teams were here ready, and we all start this process. So, like Dr. Qasim said, it's very, very important not just to treat heart disease, but to prevent heart disease. So, in the prevention aspect, we have been involved from the cardiologist side. We've conducted multiple camps, we've had multiple packages where we've gone into the patient side. The whole of this month has been that of going to the patients' offices, their apartments, identifying people at risk and counseling them about how to prevent heart disease. And this has been achieved via our marketing team who have been very prompt this year with a lot of push from our CEO who has been really pushing the marketing team to go out and reach out to the public and create awareness about heart disease in Bahrain. Heart disease in Bahrain is extensive. About 1/5 of deaths, so it's about 20% of people who die in Bahrain are dying because of heart disease. That's a lot, that's a huge number. And also part of the problem is difficult access to good health centers, where the probability of doing pulmonary intervention is there. So we have offered this unique initiative from here, wherein people can approach us directly, where we can prevent diseases as well as treat. And when it comes to the management of heart disease, of heart attack, it is very, very imperative that the people be fast. The more minutes you lose, the more muscle the patient loses, the more chances that the patient may die or have a worse outcome. So all this has been possible. Right from the beginning, the management has been very, very supportive. Physicians have been very, very supportive. Our doctors, our nurses, the whole hospital, they've been very, very supportive. Also, special mention of our anesthesia team, the cardiologist, has always been there for any emergency and capacity. And that gives us a lot of confidence that there is somebody who also doing the guidance of the patient. I mean, there have been patients who crashed in the cath lab and immediately they were shocked and revived. So this has been possible because of the team effort. And also, big thank you to all the doctors in Bahrain who have reposed their faith in us and who have referred their patients to us and allowed us to treat their patients. And lastly, I'd like to say on this occasion of World Heart Day, as the theme goes, use heart to support your heart. So the heart concept is as a nation, as a government, and then as an individual. So as an individual, what you can do? So you can protect yourself by means of having preventive heart checkups. Do a preventive heart checkup. If earlier the concept was, the heart disease starts at 60 years or 70 years. But we see nowadays younger and younger patients, people in their 30s, people in their 40s having heart attacks. Prevention should begin very, very early. Starting anybody who says about the age of 30 years, I would say, start off with annual checkup. Know your numbers. What is your cholesterol number like? What is your blood pressure? What is your sugar? And get these things checked, get these things treated, and hopefully we can go a long way in preventing cardiovascular disease in the area. Thank you very much.
Thanks, doctor, for sharing this rich information and important knowledge.